Thank you for the opportunity to speak about soft tissue mechanotherapy, a force in regenerative rehabilitation. My name is Terry Loghmani, and I became interested in this field based on many years as a physical therapist. A few years ago, I received a degree in anatomy and cell biology, and along with a certification in manual therapy and a licensed massage therapist, as well as many years with applications of instrument-assisted soft tissue manipulation, the Grasson technique, and being on faculty has placed me in a position to be able to do research in soft tissue mechanotherapy and to contribute to the field of regenerative rehabilitation. I do not have any conflicts of interest. Today, what I'd like to discuss is the potential roles of soft tissue mechanotherapy with respect to regenerative therapies and to present some preliminary evidence for the benefits in mobilizing mesenchymal stem cells into circulation. So first we'll define regenerative rehabilitation and then discuss soft tissue mechanotherapy, preliminary research results, and then some future directions. So regenerative rehabilitation is an emerging field dedicated to the reciprocal integration of regenerative medicine and rehabilitation science, ideally at the outset of therapeutic developments with an aim to improve overall outcomes. At IUPUI, we're dedicated to regenerative medicine and regenerative rehabilitation. Under the direction of Dr. Keith March, a regenerative medicine working group was formed about a year ago, and several sub-pillars with clinical focus were identified, with rehabilitation being one of those. And rehabilitation actually has implications across all the pillars, either in assessment of functional outcomes or physical measures, as well as influencing the outcomes of regenerative therapies and cell-based therapies. The School of Health and Rehabilitation Science is located here on campus and represents multiple disciplines, including physical therapy, occupational therapy, nutrition and dietetics, physician assistance, and health science. So soft tissue mechanotherapy implies that there is a mechanical stimulus that is going to affect biological activity. Its purpose is to facilitate endogenous regenerative pathways and to augment exogenous regenerative approaches. So what is soft tissue? Well, really it's about everything except bone. It includes the muscle and the fascia, and one thing we know is that it's ubiquitous and pervasive and continuous. It's not discrete elements that's separate from muscle, the connective tissue, like snaps on. You know, it's all blended. And so, and it's dynamic. In anatomy, you just kind of cut through fascia and get rid of it, but it's really the glue that holds us together and transmits forces, transmits cells, transmits fluids that are critical to tissue healing and repair and in responding to movement. So it needs to be dynamic. What happens in injury is that it can become adhered, restricted, and you lose that normal mobility, which then interferes with function overall, the inability to reach, and can cause pain as well. And mechanotherapies are often used in rehabilitation to address such soft tissue dysfunctions and to improve mobility, with the ultimate goal of facilitating innate healing potentials to maximize tissue functioning and to minimize pain. There are many forms of mechanotherapies. Some of us like exercise, some of us don't, but it's actually one of the most potent mechanotherapies in promoting tissue healing and repair and regeneration. There's modalities such as pulsed ultrasound, vibration platforms that help kind of create a mechanical jarring, and some of our preliminary results are showing that indeed there may be mobilization of mesenchymal stem cells in response to this mechanical stimulation. My focus is on soft tissue manipulation, either by hand alone or with rigid assistive devices. One thing we do know about soft tissue mechanotherapies is that they provide a direct physical force to the body that can be serve as a potent stimulus to promote tissue healing, among other forces such as neurological input and thermal. And my focus in my research is on the physical force. Soft tissue manipulation, often known as massage, is a form of mechanotherapy that's used to impart a mechanical stimulus to the tissue. And over 87% of clinicians, being physical therapists, use manual therapies on a daily basis, either delivered by hand alone or with an assistive device. And in fact, even though there's some new systems out there, the instrument-assisted soft tissue manipulation approach has been ancient, and massage is one of the oldest forms of therapies known to mankind, as you can see with Egyptian paintings indicating that this sort of rehabilitation was in process thousands of years ago. But to this day, there is limited quality research in the massage-based therapies, and much remains to be understood about its underlying mechanisms. Soft tissue manipulation is used routinely for examination and treatment and imparts many forces. So many years ago, I was interested in getting at some of the underlying mechanisms, and what we found is by applying instrument-assisted soft tissue manipulation to injured medial collateral knee ligaments in rodents, is that there were indeed improved biomechanical properties, soft tissue structure, increased blood flow, and possible angiogenesis in the ISTM treated injured ligament as compared to the contralateral uninjured control ligament. And so this made us think about, well, what could be some of the underlying mechanisms to these benefits that we found in this initial research. One thing we know through the literature is that adult stem cells and soft tissue manipulations have shown similar therapeutic capacities, including anti-aging, anti-death to cells, immunomodulation, anti-inflammatory capacities, and enhanced vascular function. We also know that stem cell circulation can be altered by many variables, but what we don't know is the effects of soft tissue manipulation on circulating stem cells. And so we decided to do a preliminary study in which we looked at individuals and treated their back with IASTM. And we chose this because low back pain is the most common disorder, and we need non-invasive, readily available, cost-effective interventions that can address musculoskeletal disorders that are only going to affect more of the population as the population ages. But to start with, we started with young, healthy males who had a BMI that was not underweight or overweight and who didn't exercise for more than 3 days a week, because we know these factors affect stem cell circulation. And this was an entry point to get some baseline data. And these individuals received 6 20-minute sessions of STM over 3 weeks to the back by a trained examiner and following the manufacturer's protocol. Peripheral blood samples were taken and stained and ran through flow cytometry. And what we found is that there was indeed a significant within sessions result of ISTM on circulating MSCs with the markers CD34 positive, 45 negative, and 31 negative. We did not find a cumulative effect across sessions, which really wasn't surprising, because just like with exercise, it correlates with the exercise literature. You can't just, it takes repeated pulsed intervals to keep the stem cells stimulated into the circulation. What's encouraging, though, we found that after a baseline rest period in which we stabilized the activity, that there was a 3.5-fold increase in stem cell circulation in response to the STM treatment. And this was at a significant level. This is interesting because although MSCs are thought originally to come from bone marrow, it's now known that they exist throughout all adult tissue and that they line the blood vessels that are invested within the fat tissue and the connective tissue. And here you can see the lining, so there's definitely a potential for tissue-resident stem cells to be mobilized, and so we're going to further investigate that. We also found that neutrophils decreased across sessions with multiple interventions, which is encouraging because these are inflammatory cells, so suggesting that STM has an anti-inflammatory effect. And the heart rate and blood pressure changed according to the position as expected, decreasing with resting prone on their stomach and then increasing once becoming upright. So our future directions are to characterize this stem cell population further with functional assays, and additional markers are going to be added with flow cytometry. Our next phase will recruit individuals who have low back pain that has interfered with function for more than 3 months, and then we're going to do a similar protocol and analyze their response to STM. This has a long line of investigation where we can also optimize STM as a therapeutic prescription, looking at the optimal timing and dose of delivery as it relates to a particular condition. And then what are the additive effects of STM with other modalities, with other regenerative medicine therapy approaches, and as that relates to given diseases. So in summary, soft tissue mechanotherapy is a powerful force in regenerative rehabilitation. It can serve as a stimulus for endogenous regenerative pathways and mechanisms and augment exogenous regenerative therapies. A greater understanding of the synergistic effects of mechanical stimuli and regenerative approaches in potentiating innate healing mechanisms is needed. And this isn't just a matter of disease. It may be more of a matter of health and prevention of disease. Because if we can stimulate these regenerative capacities through mechanotherapy, such as exercise and soft tissue manipulation, this may be able to prevent negative sequelae from developing later in an individual's life and actually serve to promote a greater quality of life for individuals. Thank you very much for your attention, and I would like to thank my team, Dr. March, Yamina Yaweed, Donnie Feng, my graduate research assistants, and the BioCourse and clinical research centers here at IU. Thank you.